Hi, my name is Jessica West. I'm a health promotion specialist and the public information officer for the Defiance County Health Department, here to present you with who and what is environmental health, where we will take a deeper look into the people that make up our environmental health division and the programs and services that they provide to our community to help them remain safe and healthy. First, we'll begin with an audio introduction by Jamie Gerken, our health commissioner, followed by an audio introduction by Mike Prigge, our environmental health director. Next, we will meet the environmental health team, learn more about what is the environmental health division, including the various aspects that go into the programs and services that they provide in our community. And then we will wrap up with a conclusion and summation of all the information we've presented you with today on environmental health.
Welcome to our continuing education on our environmental health division. Environmental health is tasked with assessing environmental health factors that may affect the health of the public. Our environmental health division is led by Mike Prigge, who is our environmental health director. We also have two environmental health specialists, Sarah and Jesselyn, and an environmental health specialist in training, George. The environmental health specialist's licensure is done through the Ohio Department of Health. There are certain education requirements that go into getting that license, as well as practical experience and passing a test to become an official environmental health specialist. The Environmental Health Division likely touches almost every resident of Defiance County through the programs that we offer. The biggest program that would affect most of Defiance County is the inspection of the restaurants, our food establishments in Defiance County. While that may be one of the largest programs that affect all of the residents of Defiance County and the surrounding area, I'm so excited for you to get a little bit of a glimpse of the other programs that the Environmental Health Division offers. I am super proud of the way that the Environmental Health Division runs in the respect of we aren't just a hammer coming in trying to find things that are wrong. We really want to work with our partners and with our establishments to educate on why things are the way they are, why the regulations are the way they are, and be a tool in their tool belt to help them succeed.
When I tell people I work for the Defiance County Health Department, their response is almost always, "Oh, so you inspect restaurants," often followed by, "Where should I not eat?" While our office does regulate food establishments, more than 250 of them, we do far more than people realize. Environmental health is a cornerstone of public health, working quietly behind the scenes to prevent illness, protect our natural resources, and to ensure the places where we live, work, and gather are safe. Environmental health touches nearly every part of daily life. Each day, our sanitarians are in the field visiting restaurants, grocery stores, schools, and food trucks, not just enforcing regulations, but educating operators, answering questions, and offering guidance. We provide food safety courses to help businesses meet requirements and confidently serve the public. Instead of simply marking violations, our goal is to build strong partnerships with operators so they can maintain safe kitchens long after the inspection ends. But food safety is only a part of our work. Safe water is another. Our team reviews and approves private water systems installations, ensuring wells, ponds, cisterns, or home water tanks are properly constructed, protected from contamination, and regularly tested. The same goes for sewage treatment systems. We inspect, permit, and evaluate septic systems, working with homeowners, contractors, soil scientists, and county planning partners to design systems that will protect groundwater and nearby waterways. Whether it's a homeowner repairing an aging system or a contractor building a new home, we help guide the process so families have safe, reliable wastewater treatment. We also play a vital role in housing safety. When concerns arise about mold, pests, standing sewage, or unsafe living conditions, environmental health staff may conduct inspections, work with landlords and tenants, or provide educational resources to help bring homes back to safe standards. These cases can be complex and sensitive, but they are essential for protecting vulnerable residents. Environmental health follows families outside the home. We inspect public swimming pools and spas, ensuring the water is clean, chemicals are balanced, and safety equipment is available. Another major area of focus of public health is nuisance investigations. From unsanitary properties, open sewage, and pest harboring, we work closely with community partners to address issues that threaten health or the environment. Partnerships ensure that challenges are handled collaboratively and effectively. Our office also plays a crucial role in emergency response. Environmental health staff coordinates with emergency preparedness teams during events such as flooding, chemical spills, boil advisories, or power outages affecting food facilities. When emergencies occur, we help ensure drinking water is safe, food establishments respond appropriately, and cleanup plans protect public health. All this work is interconnected. Environmental health is not just inspections and permits, it's prevention, planning, education, and collaboration. It is ensuring that when people eat at their favorite restaurants, swim at the local pool, drink from their well, or open their windows at home, they can do it safely. Public health is often described as invisible when it works. Environmental health is one of the most clearest examples. While people may think of restaurants first, our work extends far beyond the kitchen, and our impact is woven into every part of community life.
Thank you, Jamie, and thank you, Mike, for that introduction into our Environmental Health Division. Now let's meet the people that make up our environmental staff, who they are, and what they do in their roles. First up is George Ivory. George is our environmental health specialist in training that joined the health department in March of 2025. Over these last several months, George has been working on learning quite a bit. He's learning about our food code and how to conduct food inspections. He's been learning how to take water samples, and he's been taking a lot of phone calls as well as helping to issue permits for the operations and maintenance program that our office receives. George's favorite part about working at the health department has been the environment, saying that everyone has been so helpful and kind and willing to answer his questions as he learns more about the position. He also shared that he would like the public to know that environmental health specialists aren't just sitting at their desks all day long, that this position allows them to go all over the county doing inspections, taking samples, and helping our community to be a healthier and safer place to live. Thank you, George. Next is Sarah. Sarah is a registered environmental health specialist who works with a multitude of programs in our environmental health division, from food programs to private water, private sewage, rabies prevention, and school inspections. Now you'll learn a little bit more about all that she does in those programs a little bit later. Sarah has been with the Defiance County Health Department for 4 years, and her favorite part about working at the Defiance County Health Department in her position is that no day is the same. She tries to schedule the day, but sometimes things come up and everything planned goes out the window. The people Sarah works with are fantastic, and she says we work together to try and solve problems that arise in programs and try to improve what we are already doing. Sarah wished that people knew that there is so much more to the Environmental Health Division than just food inspections. Environmental health is involved in body art, campgrounds, swimming pools, private water and sewage systems, and so much more. And you can see that Sarah's favorite animal is the red panda and the owl. Jessalyn Atkins is another registered environmental health specialist who has been with the Defiance County Health Department for over 3.5 years. She conducts our inspections for restaurants, swimming pools, body art facilities, private water and sewage, and more. She also issues permits for new water and septic systems, collects water samples for new wells, and serves as the lead for the operation and maintenance program, where she oversees the calls, office consultation, program compliance, information management, and permit printing for the operation and maintenance program. Jessalyn's favorite thing about her position is, again, no day is ever the same. One day could be filled with inspections, another printing permits or working on reports. She also enjoys that it's a hybrid working environment, so if she gets tired of working on reports, she can go out and do a food inspection or sewage finals or any other aspect of her job that gets her out and about in our community. Her favorite thing about the health department is that despite having different divisions in the health department, we are dedicated to working as a team to benefit the overall health of our county. Jesselyn wishes that more people knew that environmental health focuses on more than food inspections. We license and inspect facilities performing body art, conduct school inspections, inspect swimming pools, campgrounds, and more for safety and cleanliness. And Jesselyn's favorite animal is the opossum. And then last but certainly not least is our Environmental Health Director, Mike Prigge. Mike became the Environmental Health Director recently after Ron Klinger's retirement. However, he has been a long-standing member of our Environmental Health Division with 9 years in the Defiance County Health Department. He oversees our staff of 3 environmental health specialists, and the majority of his time is spent making sure that inspections are completed at the required frequency and properly documented levels. We also work closely with the Department of Health and Department of Agriculture, and quarterly reports must be submitted and standards must be maintained. Mike is still involved with performing a lot of food inspections, spends a lot of time working with the private sewage program, including site reviews, design reviews, and soil reviews, and he also works closely with our homeowners and registered contractors. Mike's favorite part is interacting with his coworkers and the general public here at the Defiance County Health Department. He especially enjoys giving presentations to the public, such as our O&M program and food safety education programs. He says his most enjoyable experience is teaching the Food Safety Manager certification course and watching as food employees implement what they learned in class out in operation during their next food inspection. Mike wishes that more people knew the number of programs that the Environmental Health Division is involved in. Most people know food and septic, but there is so much more in between that each program requires a specific set of skills to effectively regulate them. And as you can see, Mike enjoys his dog Oliver. Now that we've met our Environmental Health Division, let's learn more about what all they do in our community to help make it a healthy and safe place to live, work, gather, and play. To do that, we're going to break it down into chunks or sections that will help us to better understand the variety that our environmental health provides to our community. We start with licensing and inspection, which will cover our body art facilities, campgrounds, public pools, school health, and food inspections, which also includes receiving food complaints. Our permits and registration section will cover private water and private sewage systems, along with several components under that of the O&M program. We'll also go into lot splits and abandonment of systems under that. Our zoonotic disease consultation includes animal bites, rabies prevention, and bugs. Next, we'll go into our environmental programs, looking at our food safety education course, and then we'll wrap up by talking a little bit more about what is WPCLF and what our environmental health does for public health nuisance and emergency response. Body art facilities consist of tattooing, piercing, and microblading, and these are inspected once per year in December. There are 8 facilities in Defiance County, with 3 offering microblading, 3 offering tattoos only, and 2 offering a combination of services. The license renewals for body art facilities are due no later than December 31st. These facilities are inspected for cleanliness, hygienic practices, and operator knowledge. Checking that the equipment being used is clean is incredibly important because the ink is being injected subdermally, and this can lead to infection or worse if the equipment or working area is not properly cleaned. Most of the operators in Defiance County use disposable equipment to curb the risk of infection. However, we do have one facility that uses an autoclave or a steam cleaning system to sterilize the equipment that comes into direct contact with skin. Hygienic practices and operator knowledge go hand in hand with protecting both the artist and the client. Since tattoos break the skin barrier, blood transmission is a notable risk. So our operators are required to have bloodborne pathogen and first aid training, as well as utilizing the environmental controls such as donning gloves, using barrier wraps for equipment, making sure tables and chairs are in good working order, using the proper chemicals to disinfect, and inquiring about any health conditions that the client may have. These practices again, protect both the client and the operator in providing a safe body art facility experience. Next are our campgrounds. Campgrounds in Defiance County are inspected annually to ensure compliance with both state and local health regulations. These inspections can occur any time when the campground is open to the public. During the inspection, our environmental health specialists review multiple compliance areas that include the water supply, sewage disposal, electrical systems, solid waste management, lighting, pest control, and other general health and safety standards that should be met in these little communities. Water connections are evaluated to confirm that all connections to campers are properly installed and approved methods that prevent contamination. Sewage must be stored and treated in a manner that does not pose a public health risk. And waste must be disposed of through approved on-site dump stations. Any waste collected in the holding tanks must be removed either by the park owner, provided it does not leave the property, or by a licensed septic hauler. Additional compliance checks for campgrounds include the availability and cleanliness of restroom facilities, proper solid waste storage and disposal, effective pest control measures, electrical safety standards, and adherence to general safety requirements throughout the property, such as isolation distances. Next are public pools. And when we say public pools, we're talking about swimming pools, spas, and special use pools such as rehab therapy pools and splash pads. Code requires one annual standard inspection and one annual inspection for equipment inventory. The Defiance County Health Department does 2 standard inspections of each facility per year, with one of them including the equipment inventory inspection. We have 17 licensed facilities in Defiance County, with 12 being pools, 3 being spas, and 2 being special use pools. There are 3 rounds of inspections for these, depending upon whether they're indoor or outdoor facilities. May and June is the first round of inspections for both indoor and outdoor facilities. Our outdoor facilities are inspected again in July and August just because there's such a short season for these facilities. And December is our second round of inspections for our indoor facilities. License renewals for pools are due no later than April 30th. During the standard inspection, chemical concentrations in the pools are checked, safety equipment and pool deck are inspected to make sure they're in good repair, and the automatic chemical controller is looked at to make sure it's in good working order. Reviewing documentation is also important to make sure that operators have the proper knowledge of what their role entails, such as what to test for, what frequency to test, and what to do if levels are too high or too low, and other safety standards that they should look out for. And also to make sure that they are operating their pools at a safe level for their patrons. The equipment inventory inspection is to ensure that no equipment has been changed or replaced with new without state approval. If there has been an equipment change, the operator must submit an equipment replacement notification to the Ohio Department of Health. Once that change has been approved, the records can be updated in the Defiance County Health Department system. School inspections should be completed twice a year, with our Defiance County Health Department inspecting our 8 local schools during school hours, when school is in session, checking for the sanitary conditions of all schools and school buildings in Defiance County. Some of the areas looked at during these inspections include the school grounds and building exterior, playgrounds, school indoor equipment and environment, as well as administration and other non-classroom areas. You can see our school environmental health and safety inspection form on the slide, and a short list of some things that might be looked at during inspections can include the facility, checking that it is in good repair, that there are no trip hazards throughout the facility and on the playground, and no evidence of litter or standing water. When looking at the playground equipment, our specialists are making sure there are no protruding bolts or separations in the equipment that could cause any body, clothing, or jewelry, or any other items that might be on a person to get caught, causing strangulation, injury, or worse. The furniture in our schools are to be easily cleanable, clean, and in good working repair. Portable furniture, such as banquet tables, cafeteria tables, shelves, TVs, and other things, are to be stored in a manner that is not accessible to students and only authorized personnel, and secured in a way to prevent injuries. Ceilings are inspected to make sure that they are present, intact, and sanitary with no water damage, stains, suspected mold, or peeling and chipping paint. There should be no accumulation of dust, mold, or other materials on bookshelves. Restrooms should have plumbing fixtures that are sanitary and operable. Toilet paper available in each toilet. Hand washing sinks should have soap, paper towels, or a hand dryer, and an adequate amount of trash cans. In the healthcare areas, there should be a waterproof cot or a cot with a waterproof cover, toilet and a sink, access to a phone, first aid references, and when necessary, a sharps container. One of the last items I'll mention that we inspect is custodial closets, checking that the material safety date sheets, or MSDS sheets, are accessible for chemicals used, and that the door to these areas are locked so that they are inaccessible to students when present. As Mike Prigge noted at the beginning of our presentation, most of the public is aware that our Environmental Health Division inspects our food at our restaurants for health and safety. However, they probably aren't aware that those reports are uploaded to our website every month after the Board of Health meeting for their information consideration and review. Also, most people are not aware that the Environmental Health Food Inspection Program goes so much deeper than just restaurants. There's a variety of food entities that must be inspected at a variety of risk levels and inspection requirements. I'll walk through those with you, as well as sharing some of our more common violations, and that our core really is education and collaboration with these programs. First, let's start with RFEs, our retail food establishments. These are our places that store, prepare, or sell food directly to a customer. This includes fixed locations that operate only part of the year or seasonal retail food establishments. An example of these would be our grocery stores, convenience stores, coffee shops, bakeries, and similar entities. Next are our food service operations. These are places where food is prepared and served in ready-to-eat portions for a price or a required donation. This includes anywhere that cooks, heats, assembles, or plates food before providing it to their customers. These are our restaurants and drive-thrus, but also our school cafeterias, hospital kitchens, and our nursing homes. Mobile units are food service operations that move from place to place, operating from a vehicle or portable structure that cannot stay in one place for more than 40 days in a row. Again, these would be our food trucks, mobile barbecue units, or concession trailers that rotate between locations or events. Temporary food operations are short-term events lasting no more than 5 consecutive days. So our Defiance County Fair, church festivals, community festivals, and events. Micro markets are small self-serve areas where people buy prepackaged foods. They can offer refrigerated or frozen items, but they still must meet the food safety rules. These are your self-serve snack areas, prepackaged sandwiches or salads, small checkout kiosks inside businesses. And last but certainly not least, we have the good old vending machine. These are self-service devices that automatically dispense food or drink when money, card, or some sort of exchange is used. There's no on-site cooking or food preparation, just the automatic dispensing through, again, the good old vending machine. As I said, each of these different entities have different risk levels and then require different inspection levels. So let's start at the bottom, risk level 1. These are businesses that mostly sell prepackaged, non-hazardous food or drink. There's little to no food opened, prepared, or cooked on site. These are going to be our places that sell the prepackaged snacks, offer bottled or canned drinks, sell refrigerated or frozen prepackaged foods, and operate in our micro market or food delivery setups. These could include our Dollar Tree, Menards locally, or workplace micro markets. And at risk level 1, they need at least one standard inspection per licensing period. Risk level 2, these are low to moderate risk, and these businesses do some food handling, but it's still quite limited. They may warm up food or scoop ice cream or handle foods that don't need a strict temperature control. Again, they're going to keep temperature controlled foods at the same temperature they were delivered, maybe heat up prepackaged or already cooked foods, or hand dip some ice cream. These are going to be the example that was provided with Sinner's Bar. And at risk level 2 is the same as risk level 1, at least one standard inspection per licensing period. Risk level 3, we move into moderate and higher risk. These businesses do more complex food preparation, including cooking raw foods, cooling foods, assembling meals. There's more potential for food safety issues if things aren't done properly. They could cut, grind, or handle raw meat, slice deli meats and cheeses, cook or partially cook meals, cool foods, and similar food safety actions. Our local examples of these entities are Panda Express, Ayersville School, Clubhouse Pizza, and at risk level 3, they have at least 2 standard inspections per licensing period. Our highest risk is risk level 4. This is our businesses that handle the most complex food processes or that serve people at higher risk for illness, like hospitals and nursing homes. They also may use specialized food processes that require extra controls. So they might reheat large batches of food or leftover food. They might cater meals, serve raw or undercooked animal products such as sushi or a rare steak, freeze foods to kill parasites, serve people with weakened immune systems, nursing homes and hospitals, and use time as a food safety control instead of temperature, or use some processes that require a safety plan or special approval. Local examples include Burger King, Iron Horse Brews, Asian Grill Buffet, Wendy's, and all similar restaurants and food entities. At risk level 4, they need at least 2 standard inspections plus 2 critical control point inspections and variance reviews if applicable. Some common violations that our Environmental Health Division sees at all of these entities could be improper date marking, food that is out of temperature control, either too hot or too cold, maybe in that danger zone in between, a facility not being as well cleaned or maintained as it could or should be, and the same thing with equipment, not being cleaned or well maintained at the level that it needs to for food health and safety. And again, as Mike said and Jamie shared, our Environmental Health Division is not going out wanting to be the hammer of violations. They want to educate and collaborate to provide a healthy and safe food environment for our Defiance County community. It's probably no surprise that as our food service program, we also receive food complaints from both customers and employees working in food service facilities. Most of our complaints are received through the phone. However, we can accept complaints also from phone or email, in-person visits, or through the contact us form on our website. Individuals making said complaints can choose to remain anonymous or provide contact information if they would like a follow-up on the status of their complaint. During the initial conversation, our environmental health specialists document the details on an official complaint form. Information collected include the food consumed in the days prior to any food illnesses or issues, reported symptoms, if applicable, cleanliness concerns, specific food items that are involved in the complaint, and the date and time of the visit and to which facility they visited. Once that information is gathered, the environmental health specialist evaluates the validity of the complaint. In most cases, this will result in an impromptu inspection of the facility within 3 business days. During that inspection, our specialists use the complaint details to identify potential violations that correlate with the reported concerns. According to code, there are only 3 reasons a food complaint may not be investigated. The first being if the complaint is frivolous in nature, The second is if the complaint is not made in good faith. And the third is if the complaint is too old to reasonably investigate. For example, a frivolous complaint might involve a quality issue, such as a chicken sandwich not being too crispy, which does not pose a food health and safety risk. A complaint not made in good faith would be a competitor falsely reporting unsanitary conditions at a rival facility. Lastly, if the alleged issue, such as undercooked meat, resulted weeks prior to the report, the complaint cannot reasonably be investigated. These are the only situations in which a food complaint inspection might be disregarded. Next, let's talk about our private water program. A private water system may include a well, spring, cistern, pond, or hauled water tank, with the most common in Defiance County being wells and ponds. It's important to note that ponds can only be used for a single-family home water system, and that before a new water source is installed, a permit to install needs to be issued by the health department. So what is required to achieve a new water system permit to install? The application needs to be filled out and signed, including a drawing of the water source location and any possible contamination sources, which could include septic systems, propane tanks, property lines, homes, current or unused wells, and any other contamination sources or potential contamination sources. The permit also, of course, needs to be paid for. For certain systems, we need a little bit of additional information to be considered. Ponds would need to also include a cross-sectional drawing of the pond, a list of materials, a disinfection system, and a topographic map. For cisterns, we just need a disinfection system noted. Wells will only need additional forms if there will be multiple dwellings sharing the same well. And so for that, we will need a list of materials and a drawing as to where the water lines are going. Once all of this information has been submitted and the permit looks proper, it can be approved by our environmental health specialist, and a copy of the permit is then sent to the contractor installing the water system as well as to the homeowner. Contractors essentially have 30 days from completion to submit their paperwork back to the health department so that we can review and make sure that any system is properly installed up to standards. Once the paperwork has been submitted from the contractors, we need to take a water sample to make sure that it's safe for drinking and using. The homeowner is called to schedule a date and time. Well samples are taken on Wednesday afternoons to be sent to that lab, and ponds and cisterns and hauled water tanks can be taken throughout the week to be taken to that facility for testing. To get a proper water sample, first, our environmental health specialists need to inspect the tank in the area to make sure that it has a smoothed down, turned faucet for sampling that is not less than 8 inches above the floor and has a pressure relief valve. Systems with a disinfection system, smooth sample tap, and disinfection systems matching the drawing must match the drawing given during the permit stage. In order to get a sample, they run water from a kitchen or a bathroom sink for 10 minutes. They disinfect the sample tap located by the pressure tank with isopropyl alcohol. Test strips are used to check for chlorine residue and nitrate, and if there are no signs of chlorine, then a sample can be taken. Our specialist will open a bottle and take a sample, making sure that the faucet does not come into contact with the inside of the bottle or lid. The sample is put into an ice pack, and when returning to the office, the sample and paperwork is put in the fridge for the lab to pick up the following day. When inspecting a well that has been installed, they need to make sure that the well lids are secure with 4 bolts securing the lid, that the casing is at least 12 inches above the ground, that an electrical conduit is secure to prevent dirt and insects from entering the well, and that it meets the isolation distances in the area that was approved on the permit. When getting back the well sample results, they are looking for the most probable number. If it comes back positive and does not meet Ohio standards, then we have to inform the homeowner of these results and the homeowner will contact the water contractor who installed the system to disinfect the system again and to check over the disinfection system. Another sample will be taken and paperwork is sent to the homeowner and contractor about the failed water sample. When the water sample comes back negative, then it meets Ohio standards and the homeowner and contractor are notified of this as well. Our environmental health specialists fill out an administrative summary with their observations, water results, and then sign off for approval. There's a lot that goes into our water and a lot that goes into making sure a new water system is safely installed. The sewage program oversees all private septic systems within the county for properties without access to the public sewer infrastructure. The primary goal is to ensure proper installation of new septic systems and address public health nuisances caused by aging or failing systems. All new systems installed in Defiance County must utilize soil absorption technology, which consists of two main components, the primary component of the septic tank and the secondary component of the soil absorption area, such as a leach field or mound system. The installation process involves several critical steps. First, the Defiance County Health Department reviews the soil report and the proposed system design. The soil report is essential for identifying limiting features such as wetlands or perched seasonal water tables and ensuring that the design aligns with site conditions. After design is approved, a site review is conducted to verify that those conditions are suitable and the system layout is properly marked. Once the permit to install has been issued and installation begins, an inspection is performed before the system is covered to confirm compliance with design specs. If approved, the installer may proceed with covering the system. A final inspection follows to ensure proper completion. Additionally, within 12 months, a post-installation inspection is conducted to verify continued compliance. Once this is done, the system is monitored through the Operations and Maintenance Program, which we'll talk about in a bit. When sewage nuisances occur, the program investigates surrounding properties for old or failing systems, which often discharge through field tiles. To identify the source of the problem, a dye test is performed by introducing high visibility dye into the suspected system and monitoring it for surface emergence. If the dye appears, the failing system must be upgraded to meet current code requirements. In cases where a soil absorption segment cannot be used or sized for a smaller lot, a National Pollutant Discharge Elimination System, or NPDES, permit may be allowed. These systems discharge effluent off the property, but only after advanced treatment processes such as UV disinfection. NPDES systems are rare in Defiance County and require an EPA permit as well as annual testing to ensure the effluent leaving the tank meets treatment standards. The Operation and Maintenance, or O&M program, is an unfunded statewide mandate that requires homeowners to take a more active role in the health of their septic system. And it requires to get them a septic pump or inspection to meet compliance. There are around 5,000 septic systems within Defiance County, and the program breaks these properties down by townships. We have 4 groups, A, B, C, and D, and each group has 3 townships. A permitting cycle for this program lasts 4 years when a group is renewed every year. There's a $60 fee for the permit and the renewal date is by June 30th. The action, the pump or inspection, is required to be completed before the renewal date, unless the homeowner directly contacts us to be placed on a grace list that gives them until December 31st to complete the action for the previous cycle. There are 3 mailings that go out to homeowners for renewals, as well as multiple social media posts and reminders. Their septic compliance status is indicated on the mailings. Once the applications have been paid for, a permit with a specific, system-specific information is mailed back to the homeowner. Aeration units and NDPES systems have different requirements than regular septic systems. Aeration units have a motor that brings oxygen to treat the effluent and that requires a licensed professional to inspect it. A service contract is required for these units. NPDES units require annual sampling, and these are permitted by the EPA. Lot splits. When it comes to lot splits, the Defiance County Health Department's primary role is to determine whether a replacement septic system can be installed on the newly created lots. The requirement is outlined in the Ohio Administrative Code 3701-29-08C2, which states that no lot shall be created which requires an NPDES permit for discharging of a sewage treatment system. All created lots shall meet the requirements of Rule 3701-29-06, which means all new septic systems must utilize the on-lot soil absorption. The NPDES system, as mentioned earlier, is the only legal situation where a private sewage system may discharge off-lot. Because of this rule, our environmental health specialists must verify that any new lot can accommodate a replacement system that meets current sewage code if the existing system fails. For lots greater than 5 acres, the process is pretty straightforward. We check the status of the O&M program, and if the property is compliant, we can sign off on the split. For lots that are less than 5 acres, even if additional land is added, a soil test is required. This ensures whether a new system and a replacement system can be installed for a vacant lot, or at least a replacement system meets current code for a lot with an existing home and system. Once a soil test is received and reviewed, our health department environmental health specialists conduct a realty inspection if there is an existing home. In this inspection, they are checking the location of a well, septic tank, and any other structures that require isolation from sewage treatment systems. This ensures that our specialists know where can and cannot be placed for a replacement system on the property. After the inspection, a soil report is used to create a spatial layout for the system area, either for both new and replacement system or just a replacement system. Our specialists confirm that it fits on the lot while meeting all required isolation distances. If the system fits and O&M requirements are met, the lot split is approved. If it doesn't fit, then it must be disapproved. If it fits but O&M requirements are not met, the system must be brought into compliance before it can be approved. Septic tank abandonment is sometimes necessary due to tank damage, septic system failure, changes in building size or use, or a prolonged lack of use, such as on vacant lots. When a new sewage treatment system is installed, any old tanks being replaced can be abandoned under the permit to install, and this work is completed by the registered contractor responsible for the new system. However, when tanks have been unused for years or decades, a separate permit to abandon the tank must be applied for, and a registered contract is not required for demolition. Before the tank can be destroyed, its contents must be pumped out and a pump report submitted to the health department. Once this report is received, the permit to abandon it will be issued. To properly abandon a tank, the top must be destroyed and at least one side wall fully removed. After demolition, the individual who destroyed the tank must contact the Defiance County Health Department so that an environmental health specialist can inspect the site, confirm proper demolition, and sign off on the permit. Once approved, the environmental health specialist will instruct the individual to fill in the hole. This process ensures that abandoned tanks do not pose an environmental or safety hazard. Wells, also that are not maintained in compliance with code, must be properly abandoned by a registered water system contractor, unlike septic systems where a contractor is not always required. During abandonment, the well must be cut off below grade, then sealed with grout to prevent contamination and ensure safety. The contractor responsible for sealing the well is required to submit a well sealing report to the health department within 30 days of completing the work. Once the report is received, the health department reviews the report using the grout calculator provided by the Ohio Department of Health to make sure that enough grout was used to properly seal the well. Once the calculations are complete, an environmental health specialist will conduct an on-site inspection to verify that the well has been properly sealed and covered. Our health department is committed to supporting our local food professionals by providing high-quality, in-person food safety education. The goal of hosting these trainings is to give operators, managers, and employees the opportunity to ask questions, strengthen their understanding of food safety principles, and interact with fellow business owners in a collaborative learning environment. By offering these sessions locally, we help ensure that our food service staff have accessible options for meeting the state requirements. Food safety training is required under Ohio Administrative Code 3701-21-25, which outlines certification requirements for food protection managers and their personnel. To meet these standards, our office utilizes the Serve Safe curriculum, a nationally recognized program that provides comprehensive instruction in the prevention of foodborne illnesses. In order to offer these courses, our environmental health specialists are required to complete the necessary certification process through the Ohio Department of Health and maintain those required credentials for delivering both person in charge and manager certification trainings. We have been offering the Serve Safe person in charge and manager certification courses for over the last 3 years. The person in charge class is a 3-hour training that utilizes a PowerPoint presentation as well as a follow-along workbook. The manager certification course is a 2-day class that incorporates the Serve Safe workbooks, instructional videos, discussion, and hands-on activities to help participants understand key concepts such as proper cooking temperatures, cross-contamination prevention, employee hygiene, and safe food handling practices. When an individual is bitten by a dog or other non-human mammal, the report of the bite should be made within 24 hours to the health commissioner of the district in which the bite occurred. That report is required to be made by any healthcare provider, any licensed doctor of veterinary medicine with knowledge of the bite, or by the individual bitten with the form that you see on the screen. When that bite form is received, if the bite has occurred in Defiance County, the information is put into our HDIS system where a report is generated. If the bite did not occur in Defiance County, we will forward the form to the health department in which the bite occurred. If it's a dog bite, the investigation report is sent to the dog warden. For all animals, if the owner is known, a quarantine letter and vet report is sent to the animal owner. If the owner is not known, a victim letter is sent to notify the victim about the rabies virus and post-exposure vaccinations. If we've not received a vet report within 3 weeks, a final notice of quarantine will be sent with another vet report. If it is still not received, then that report is filed away. The animal will not be released from a quarantine until we receive the vet report and shot records have been accepted as well. If the animal should die within 10 days after the bite, it is required to be sent off for testing. It's important to note that if the health department is not notified of the death until days later, where it's possibly buried or the brain is too decomposed to test, then we will not proceed. We're not going to go around digging up bodies. If testing is allowed to proceed, then the animal head, or with bats, the whole body, needs to be packed in an insulated container in a plastic bag with paperwork, also in the bag with an ice pack. If the head needs to be removed, the health department is contracted with Dr. Brian Haar, Doctor of Veterinary Medicine, to help us with this process. The box with the head, the paperwork, and the ice pack are sealed shut and placed in or on top of our pickup box, which you can also see photographed here, so the courier service can pick it up and deliver it to the Ohio Department of Health labs. Lab results should be received the following afternoon, and those results are given to the victim, the animal owner, and the vet office are notified of those results. Now let's talk about bugs. The Defiance County Health Department oversees disease transmission through vectors such as mosquitoes or ticks, and we can expect properties for harborage conditions such as tall grass or standing water when complaints are made to the health department. These kind of situations create an environment for mosquitoes to breed since they lay their eggs in standing, sometimes stagnant water, and both ticks and mosquitoes like that tall grass. Both ticks and mosquitoes are tracked more closely by the Ohio Department of Health, and as the Defiance County Health Department, more of our calls concern bed bugs. Bed bugs do not transmit any known diseases to humans, and they're seen more as pests. Some individuals may have an autoimmune response to their bites, which results in red itchy bumps that can vary in intensity from person to person. Occasionally, live bed bugs are brought into the office for identification, and resources and education are provided to mitigate their presence within the home. Bed bugs are difficult to get rid of because of their rising immunity to smoke bombs and sprays, which do nothing to kill the eggs. Heat treatments and diatomaceous earth are the most recommended options to kill the eggs and any adults that climb off of furniture. Whole house heat treatments can be expensive and may be necessary depending on the level of infestation. Unfortunately, there are no county programs to assist with bed bug infestations or removal. WPCLF stands for Water Pollution Control Loan Fund. This is a loan in name, but it's really a grant, as the homeowners do not have to pay back, and the health department has had this program for at least 10 years. Defiance County has been awarded $150,000 a year to use, and health departments have 18 months to draw funds from the loan, which is funded by the EPA. This is an income-based program with homeowners being able to qualify at 100%, 85%, or 50%. And you can see the eligibility grid on your screen. Other eligibility requirements are that the property must be occupied by the homeowner. It is not eligible for funding if it is a rental property, new home build, or homes that are advertised for sale. Homes that are being purchased via land installment contracts per Ohio Revised Code Chapter 5313 are eligible for the funding. And homeowners need to be able to document income and household size to qualify for the loan. For the application, we need verification of the need. What is wrong with the septic system? Are there cracks in the tank? Is the tank collapsing? Is there root intrusion? We need verification of income either through tax returns for each occupant receiving taxable income, or if taxes were not filed from the previous year, any information on the current income and sources of income should be provided. Our environmental health specialists look over the application and income and determine how much the homeowner qualifies for. If they qualify at 85%, then the homeowner would pay 15% of the project, or owe 15% of the project. The contract process for WPCLF starts with the health department bidding the project out, after, of course, the application. We receive the bids on the project. We evaluate those bids, and the lowest and best bidder is selected. A bid package with notarized affirmation is submitted to the EPA, where they will approve the bid package, and then the health department will enter into a contract with a sewage treatment system contractor. The contractor will perform the work. The work is inspected by the health department. We will then request pay by a submission to the EPA. The EPA will approve the pay request. The funds are dispersed to the health department, and the health department disperses the funds back to the contractor. This process is also done for soil and system design, since they are no longer being facilitated by our health department. And we keep repeating this process until all the money is spent in the fund. Lastly, as Mike noted at the beginning, Our environmental health specialists do work with public health nuisances, collaborating with our community partners to make sure that education and enforcement are properly handled in a collaborative effort for public health and safety. Also, in any sort of an emergency situation that involves our water, our food, or any of the many environmental health programs that we've covered today, our Environmental Health Division steps in to make sure that our drinking water is safe, that our food is safe, and that health and safety standards are maintained. In conclusion, we started our presentation today with an overview by Jamie Gerken talking about how proud she is about the education efforts that our Environmental Health Division takes to make our community a healthy and safer place to live. Mike then shared with us that it is so much more than just checking our restaurants and ensuring that they are safe places to eat, and that there is so much more that goes into our Environmental Health Division work, that they are the invisible hand behind public health and safety, making sure that all aspects of our everyday life are safe in Defiance County. We met our environmental health team, which consists of George, our environmental health specialist in training, Sarah and Jesselyn, our registered environmental health specialists, and Mike Prigge, our environmental health director, and learned a little bit more about who they are, what their role is, that all of them think that no day is the same and they love that about their role, and that they also wish that the public knew more about the work that they do in our community and that it's more than just food inspections. Next, we walked through the Environmental Health Division programs and services and learned that it is so much more than just food inspections, that we're looking at our body art facilities, campgrounds, pools, and schools, making sure that they are all healthy and safe and meeting those health standards for their patrons or clients that they serve. We did talk about the food inspection program, that it goes so much deeper than just our restaurants with different risk levels, and that those reports are available on our Defiance County Health Department website every month after the Board of Health meeting. That food complaints can come in from an employee or a client in a variety of methods, from email, phone, in person, to our website, and that they must be addressed unless they meet those 3 special conditions. We talked about the various steps that need to go into a private water and private sewage system being installed. We learned a little bit more about animal bites and bugs, and we also learned a little bit more about the WPCLF program, the O&M program, and the other specialty services and emergency situations that our Environmental Health Division might respond to. As you can see, our Environmental Health Division is busy every day in a variety of ways to ensure that our community is a healthy and safe place to live, work, and play. It's not just food inspections, but they truly are the invisible hand of public health and safety, making our everyday a safer place to live and work. Thank you for joining us on this presentation of who and what is environmental health. If you'd like to learn a little bit more, I invite you to please reach out to one of our environmental health specialists or environmental health director, Mike Prigge, or visit our website at defiancecohealth.org/EH to scroll through these and the more that our Environmental Health Division does to make Defiance County a healthy and safe place to live. Thank you.